So BACE1, I was involved in the cloning of BACE1 back in 1999 when I worked for Amgen. And BACE1 is the beta secretase enzyme that initiates the production of the A-beta peptide that forms the amyloid plaques in the Alzheimer brain. And so back, when I joined Amgen in 1996, it was clear to everyone in the field that the beta secretase and the gamma secretase, which is the other enzyme that releases A-beta, that they're both, very key therapeutic targets for Alzheimer's disease. So my colleagues and I underwent an expression cloning screen, and we identified the enzyme, and we called it BACE1 for beta site APP cleaving enzyme. And a number of years passed, and several companies got involved and made BACE inhibitors. And they went through phase 1, 2, and 3 clinical trials. But in phase 3, they got all the way to phase 3, and then they were discontinued because they noticed a side effect to these BACE inhibitors. The BACE inhibitors engaged their target in the brain, reduced A-beta production, as they should, and they appeared safe in the earlier clinical trials, but at higher doses, they produce a cognitive worsening, exactly the opposite of what you want for an Alzheimer's drug, right? And so they were discontinued, but I think they threw the baby out with the bathwater. I think that we can find a safe dose of BACE inhibitors and lower A-beta just a little bit. And over a long period of time, that would be enough, I think, to delay the onset of Alzheimer's disease. Or, you could follow up the immunotherapy, the antibodies that clear A-beta out of the brain. What you could do is then follow it up, once you've cleared the amyloid out, follow it up with a low dose of BACE inhibitor just to keep the plaques from coming back. So anyway, that's kind of like what I'm going to be talking about.